Hello everybody, thank you for asking me to come today. It's always great to follow somebody with great sexy videos. Unfortunately I have to rely on my personality, which is a problem for you for the next 15 minutes. But thank you for asking me to come. I manage the Faculty of Medicine and Health Sciences at the University of East Anglia. Yes, it's a more exciting job than it sounds. Yes, I'm supposed to be here. It's a long way away from Norwich, but I'm very glad to be back in the Isle of Wight talking to people about the work that we're doing within our health partnership there, and the parallels. So there's quite a lot of parallels. This is an AI presentation without AI in it, so if you're a tech professional and you'd like to get some coffee, please do. I'm going to be talking more about how do you encourage the environment, how do you bring people together to try and help AI and everything else in digital actually get employed. So it's more about the realities of day-to-day life. Very quickly talk about population comparison between the two regions. I'll talk a little bit about our independent living project in particular. But I'm going to keep banging on about collaboration, which I know is not new to you. You were very smart, and if I might say so, an attractive audience as well. You clearly know how to collaborate, but I think maybe just reflecting on what we're doing there might help you think about some of the challenges you have on Ireland too. I don't know how many of you know Norfolk very well. Very few people know Norfolk very well. There's Delia, there's Alan Partridge, the older ones of you may know Bernard Matthews. Turkeys is our big thing. That's a problem. We do that because we don't do very well on reputation. And actually on the table earlier on, people were saying we need to work on our identity in the Isle of Wight. It's like, yeah, not the only ones. These comments, which you more or less can see, these comments I dragged out of an environmental analysis from a report last week on Norfolk and Suffolk. Now, we don't have time to go through all of them, thank God you say, but I think as you scan that, you'll see some familiarity there. And so I think we're too nice. Maybe both regions are too nice. We need to be slightly ballsier about our attitude and about the strengths we have. They're great strengths in the room, by the way. I was slightly scared when I read this after yesterday's meeting with the council, thinking it's exactly the same stuff. We're all facing the same issues. One of the big issues we're facing in health and care, as everybody's been saying before, is the ageing population. It's a challenging test bed. So I discovered it's a test bed yesterday and an opportunity as well, but it's a very, very big challenge for us. You can't compare these two data sets exactly, so I don't want to get into that. They're slightly different measures across the bottom of the screen, but you can see a consistency there in the Isle of Wight on the left, just making sure you can see it, and Norfolk on the right, the same shape. You can see the disparity there with the black lines around the UK average as well. You can see the lack of 20s and 30-year-olds that we've been talking about on our tables today, and you can see that grand expanse further up the charts. So Norfolk is between 5 and 13% higher than the average in everything above 60 years old. Norfolk's really, really nice. People never leave. When you arrive in Norfolk, as if you come out of region, they say you come to Norfolk to die, and you go, God, okay, that's a hell of a welcome line, thanks very much. But people don't leave, people retire there. People just move there. I moved there with my family, my wife was from there. It was the best place to bring up kids. It's really difficult to say as a Welshman. Very best place to bring up kids because it's very stable and very nice, but people never leave. And what that does is cause some significant issues within our healthcare. And I could have found similar headlines from local papers here. To be honest, I found so many I didn't know which ones to include. But this was from last week, I believe. Oh, sorry, from last week in the EDP. It's a major issue for us as well. And there's investment in going in around Norfolk, but it will not meet the demand. So here's the shameless plug for my university. We're actually very, very good, but you don't know us very well because we don't do reputation. Year before last, we were the most cited university for life sciences research in the country, so suck that, Cambridge. I think Portsmouth is this year as well, so we keep switching. But we're very, very good, but we don't make a lot of noise about it, and we also, I would freely admit, historically don't collaborate well across our area. We focused on international probably for the last 15 years. But 3 years ago, the local economic partnership, our LEP, forced us into a conversation, and it brought the anchor institutions together and said, well, what are we going to do? And you see a change then in our strategy about 3 years ago. It's still long and verbose and probably don't want to read it, but it's got much more of a focus on how do we help our backyard. There's a lovely phrase in there, we are going to create networks that key stakeholders want to be part of. And that's a significant change of direction for UEA. We had to be pushed there, but it's making a huge difference. And one of the key results is health and care partners. Some of the logos are health partners. It's become health and care partners now because we've just got the Norfolk County Council come in. So we've got primary, we've got acute, we've got mental health, we've got community, and now we have care. And it gives us the opportunity to work across the whole system to bring much greater research and innovation into the space. I can talk about this quite a lot, but we have a limited amount of time. The takeaway from this slide is not so much the numbers. The numbers are actually wrong. They're much higher than that. It's more about the level of collaboration we're seeing in a space where previously there wasn't very much collaboration. Chief execs in Norfolk described the health sector as a nest of vipers. They were driven against each other through different policy and through competition. They're only learning now on how to collaborate. So the fact that they've come together and they've invested money when some of them are up to £70 million in deficit is quite a statement. What they're going to do is this. And again, because of time, I'll draw your attention to the how. So we've chosen to go through a civic partnership model. So that's us laying aside our particular sector interest and we're just focusing on our service users and our health and care professionals. But that bleeds already, so we've already got the police coming to us and saying, can we work on data sets together? How can we work with you? How can we do things together? And what we've tried to do is remove barriers to people working together, because there were plenty of barriers before. We have tools for idea capture. We have agreed workshop tools to bring people together and to form new ideas. Similar sort of stuff that we've done today, but it's a very regimented approach. And we have structures and templates for our research and innovation teams. So we move them forward and we make sure they deliver what they said they were going to do in those draft theme areas. Very briefly, some of our big projects have taken quite a long time to build. Not because of the size, not because of the cash, but because we weren't used to thinking that big and thinking outside of our little bubble. So we're trying to bring people together to think about other purposes rather than their own budgets. My Evolution on the left-hand side is a tool that we're giving to our students to help them plan all the way through from their degrees to becoming managers of health systems. We hope at the next stage, through IBM's help, to make that a national facility free to 1 million users across the country to be able to chart their way through. And that may offer the care sector as well a way of professionalising the different routes through and giving people a very clear sense of ambition and draw more people into the business. I can't quite believe I've got this on the slide today, but there is European funding available still. So our LEP is putting a bid in, £2 or £3 million at the moment, around ERDF to build research innovation capacity, because most of our organisations have very little. Universities quite good at research, don't tell anybody else, but as innovation we still struggle a bit, and our hospitals have almost nothing. Of our turnover, it's less than 1% of our income across our region is for research and innovation. So that fund will help us bring SMEs to work with the NHS and with care much more easily and buy time in hospitals so they can build capacity and the skills they need to innovate on their own. And lastly, My DNA is another good example of collaboration. That we just wouldn't have done this without bringing those different bodies together. It comes out of our medicines optimization research group, which is all 12 organisations coming together to talk about how they can work on polypharmacy, how they can bring down the costs of drugs. And My DNA is an Australian company that does a cheek swab. It gives you a DNA test and it tells you your sensitivity to the top 30 drugs in the world. And apparently, it's revolutionary, because previously a pharmacist would look at your ethnicity, your weight, your medical background. This thing tells him whether or not warfarin works for you. So the cost saving, the saving on the system, and the saving to the patient is incredible. They had 3 meetings as a group, and the 4th meeting they put in an £800,000 bid to Innovate UK. They wouldn't have done it without the collaboration of the group. So independent living is one of the central strands to what we're doing. I think it's a major opportunity. I know it's a challenge for a lot of people in the room, it's their jobs, but it's a major opportunity as well. It's across all funding streams now. It's one of the 5 grand challenges in the industrial strategy. I'm sure you all have that by your bedside table. Great read. It's very, very central to how we move forward as a society. And this is our little project. This isn't unique. It really isn't unique. But we think we've got a few good ideas in there, and the way it's building is incredible. So Colney Hall is a hall in Colney, which is just down the road from us. It's 80 acres of outstanding ecological site and a very beautiful place, but the owner wants to do something special. He's entering later life now. He's quite scared. He wants a decent time in later life. And he's also very upset because he visits care homes with his family, he spends thousands of pounds, and he's disgusted with some of the things he sees. He sees it as a gradual decline. That's me paraphrasing. He's much more negative about it. He sees it a ticking clock until death. And so what he wants to build there is a completely different approach. He wants to look at the life cycle. He wants to make that last third happy and healthy like the first third. He wants to make it stimulating. In the centre of his site, he has a Montessori school, which is all about scientific observation and experimentation, creativity. He wants you to have as much of that in the last third as in the first third. Now, again, as I know, this is happening here. I know the council are thinking about a similar sort of way of building a site that will work together with the local school, trying to bring old and young together. Think about giving people much better experiences. And Colney Hall is going to do that, but it'll do one other thing as well. So we're really interested, not because we know anything about running these sorts of places, we're not going to do that. We're coming in as the research partner. And across the bottom are some of our major partners. So Norse Care has been mentioned a few times. They were supposed to come today, they couldn't make it. They're a wholly owned subsidiary of Norfolk County Council. They're the largest care home provider in the region, and they're at the cutting edge of delivery. They're building specialist dementia homes, specialist supported living centres. And between us, we can see a way of making this the most hyper-connected, independent living, best practice community that we can find on the map at the moment. And with IBM's help, and probably with some help from Barclays as well, we think we'll be able to make not just a very sexy architect's drawing, but that site on the right-hand side, much more detail, many more facilities, a proper community that should be stimulating throughout later life and into end of life, because we think we can build palliative facilities in there as well. But UEA's real interest is whether we can build this and we can draw data from every possible aspect with the patient, the service user, the residents, full cooperation, so the ethical approval would be in from the start. And you'll be able to opt in to a number of different ways of feeding in data. And this is where the AI comes in, because after 12 months with 250 apartments, even with a small number of people becoming part of our research studies, we could not crunch that data. We just couldn't run through it to find where the patterns are, and that's why we need IBM, because we need that kind of processing power. We think it could revolutionise pathways. We think through our local healthcare partners that this could make a change on a daily basis to the way people are cared for. We think it will help us to analyse the effects of ageing much more quickly, because we have a longitudinal data set. As I said before, these people never leave the county, so we've got great access to a very long-term data set. And our academics are already getting excited because they can see studies across the piece. This isn't just a dementia village that you might have seen popping up around Europe particularly, but it covers all those areas, all those opportunities for much deeper, much more meaningful research. So that was a bit of a rush through. That's probably a good thing for you guys because it's been a long day. But in summary, I would say, I'd remember when you're thinking about the Isle of Wight, there's more similarities than differences across the country. There's ways that we can collaborate, there's ways that you can solve our problems for us as well. It doesn't have to go the other way. I pursue formal connections. These kind of gatherings are fantastic, but I would be looking for formal health and care structures that operate across more than one organisation. And we wouldn't lose sight of what those values that you've got are and what the needs of your population are, or if you're on the private side, the needs of your market. That's what makes you successful. I build on the exceptional momentum you've already got in the island, and the people I've spoken to over the last 24 hours are really impressive. So you've got the resources and the intellect around. And I just ask you for a favour, and that's when you've cracked all this stuff, if you can come and collaborate with us, because we've got many of the same problems. Thank you for listening, and stay in touch.